Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center. Today is Thursday, July 16th. Let's look at the graphs. The first graph is the activity in the hospitals in the 8 counties of the Capital Region, and currently there are 33 people in those hospitals being treated for COVID-19. That number was 32 earlier in the week. As we mentioned, Fred, given the increase in positive tests in the counties,
yes,
we're watching very carefully the numbers in the hospital. Thankfully, it's not going up, but we're going to watch it very carefully.
We absolutely are, Dennis.
Right. And then let's look inside here in the medical center. This graph is the morning census. These are people in the hospital being treated at Albany Medical Center for COVID. That number today is 19. They are all on the floor, so there's none in the ICU and obviously none on the ventilator. Again, a number we're watching very carefully.
And Dennis, of the 19, 12 are acutely ill. The other 7 are those congregate living folks waiting to test negative.
The difference between that solid line and the dashed line. Exactly. So staying on that theme, Fred, we introduced a couple concepts on Tuesday that we want to bring up again today. We talk a lot about the safety in the hospital. We have a whole campaign associated called Safe for You. And there are 2 things that we want to emphasize. So the first one is when there are people in large gatherings, what we do in order to obviously be safer in that area. And I think there's something we're going to pop up on the screen, and it has 4 main points.
That's right, Dennis. So this is a sign that we're putting up around the medical center to remind people. So it talks about if you're going to be in a room, social distance, be 6 feet apart. If you can't, wear masks. If you can do a meeting virtually, then perhaps that's a better thing to do. And always, 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 hand hygiene. Wash your hands. Very, very important.
And so to that point, Fred, you and I were just in a meeting before this, and it was a virtual meeting, number 1. And number 2, we were in a room large enough that we were spread out.
That's absolutely right, Dennis.
So those signs will be going out around.
They've already started to pop up, but we're going to put them in even more locations around the hospital and the college just to remind people.
Very good. The second point we wanted to emphasize was more about on the front lines, care providers. And we mentioned our epidemiology team had looked at this and said when the testing in the community is greater than 2% positive, we would put into place some additional safety measures. And one of those has to do with protection of the eyes, since mucous membranes in the eyes. And you talked about that on Tuesday, Fred.
We did.
And we have a campaign associated with that.
That's right. So droplets can infect you through your mucous membranes. So we want to create a barrier. And so up on the screen now is a flyer that's going out about the different ways that people can cover their eyes, face shields and goggles that we're providing to all our staff when they're in contact with patients. And so that's something that's going into effect as of a messenger that's going out this afternoon.
Great. Very good. All right, so we look forward to that as another measure to protect our staff and obviously protect the patients and the community.
That's right, Dan.
All right, let's change gears here. Fred, 100 in 100. That sounds like a campaign I want to get behind. What is 100 in 100?
So, Dennis, during the COVID pandemic, a lot of things slowed down in the medical center, including recruitment.
Yes.
So normally in the spring, that's a big recruitment time for nurses here at the medical center, and that kind of slowed down, and we've got a little behind. So we're going to very aggressively enhance our nursing recruitment, and so we're calling it 100 nurses in 100 days.
Excellent.
So we are fast-tracking all the applications that are currently in our system. We're going to do some group interviews. There's a whole program that we're going to do in conjunction with the human resource folks, the recruiters there, and our nurse managers and our AVPs in nursing. So we're going to go at this very hard.
This is great, and we know that there are nurses out there who are either graduating from nursing school or nurses who may have worked in other places in the Capital Region where they may no longer be working.
That's right.
But we're actively pulling those nurses in for interviews, which is great.
We're absolutely going to do that.
I think we have an example even in the first week of this 100 in 100 where we've had some great success, and it ties into some important, I'd say almost historic numbers related to activity in our operating room.
That's right, Dennis. So Sharon Bessel, Rich Ewell, and other members of the team in the operating room, first of all, are doing a tremendous job. The volumes have actually bounced back.
Yes.
We actually have had a week where it's the highest volume we've ever had in the main OR.
Pretty remarkable.
So just a tremendous tremendous effort on their part. They are very aggressively going after recruitment and have actually made offers and signed up 11 people
In the last week.
in the last week,
Which is remarkable.
to join perioperative services, so the operating room, pre-op, and post-op, so across the whole peri-op system.
Very good.
Yes.
So, and I know they're going to continue to look for even more nurses.
They absolutely are.
And that's an example of where we're doing that. We're going to do that throughout the house. So if you're out there, if you're a nurse and you're looking to join what I would say is the best team in nursing in the region, give us a call.
Absolutely.
Very good. All right, Fred, let's shift gears a little bit. Let's talk about emergent care. Speaking about best in the region, we have an incredible emergent care set, about 12 sites out there
12
currently.
sites, yep.
Very good. And you, of course, have been part of the growth of that for many years. And one of the things that we're looking to do is to adjust the hours of a couple of those sites as what we think will be an opportunity to reach some people who may not be able to reach us right now. So what am I talking about? Emergent care normally runs 9 a.m. to 9 p.m.
That's right.
There are some people who might prefer to go to an emergent care on their way to work. So we think there's two sites that we're going to start with where we're going to try to open up, instead of 9A to 9P, we'll go 7A to 7P. And we'll partner them in locations where there's another site nearby, so now you have some choice.
That's right. And those two sites are our Glenville site on Route 50, which will be partnered with our Niskuna site. So Glenville will be 7A to 7P, Niskuna will be 9A to 9P. And our Latham site on Route 9, where our medicine pediatric practice is. Again, that site will be 7A to 7P, and we'll partner them with Wolf Road, which will be 9A to 9P.
Which is great, and I think we're going to launch this August 1st, so keep an eye out for that. But this, we think, is another opportunity for people who want to come in and access our emergent care to do so with new hours, which is wonderful.
We're trying to be responsive to the community.
Speaking of which, we know also, and we'll remind you, the emergent care offers video visits, and that's something that you can access via the website. You can look that up, and antibody testing.
Right.
And most insurances will cover that, and if not, it's a very small out-of-pocket expense. And there are certain criteria you need to meet, such as you live in a congregate facility or you're going to be a plasma donor. But there are criteria, but we're offering those sites as well.
That's right.
Very good. Fred, we were reached out today by Dr. Frisch, and he said, I think there's an important message that we need to communicate to our workforce about the risk of smoking as it relates to COVID. And we know, of course, that COVID affects people's pulmonary system and their lungs, and of course smoking is a factor. And Fred, the literature would suggest that there's some causality there.
That's right, Dennis. So there are a number of papers out there that suggest that if you're a smoker, and you get COVID, you're going to have a worse outcome.
Right.
Higher risk of respiratory failure and all the bad things that can happen with COVID. So there's no better time than the present
Yes.
to try to kick that habit. And Dennis, while this is a message for our employees, and we have opportunity for them here in terms of counseling around tobacco cessation, this is a message for our community as well.
Correct. Very good. So, and if you are an employee and you're interested in quitting, like Fred said, no better time than now. Reach out to our employee health service and they'll be happy to set you up with some services. Dr. Barbara Ostroff is the chair of pediatrics here, and she heard us, Fred, talking about mental health a couple videos ago and how these were stressful times for many people.
Yes.
And she wanted to remind us that in the Department of Pediatrics, which she very capably leads, they have an initiative there that focuses on mental health during the pandemic. And there's a series of things that department has done, including education, some surveying of their workforce, some meetings and support groups. And I think it's Dr. Gina Geis and Dr. Melissa Doyle who've led that effort.
That's right. This is very important. You already said that this is a stressful time for many folks.
Yeah.
Social distancing can mean social isolation for some people.
Right.
It's important to reach out if you're struggling. And what they're doing at pediatrics, I think, is exemplary.
Yes, I agree. And great leadership by Drs. Ostroff and Doyle and Geis. So thank you for that. Finally, Fred, last night was Journal Club. The topic was
obstetrics.
Okay.
So COVID infection in the pregnant soon-to-be mom, and also the effects on neonates, and topics like whether or not there can be vertical transmission, so a mother infected, whether they also infect their child. It was an interesting Journal Club. Lots of things that are unknown.
Yes.
can COVID be transmitted by breast milk, as an example.
Okay.
But it was a very, very lively, very good conversation. And questions by some of the participants were quite interesting. Someone you know well,
yes.
love dearly.
Dr. Lee Powell.
Marty asks the best questions of the night.
Of course, she always does.
She always does.
And I just want to highlight, we would both like to highlight the great work of our library here. So these journal clubs are put together with the assistance of our Schaefer Library staff. And let me just read some of these, Fred, because this is remarkable. So Enid Geyer, who's our Associate Dean for Information, Resources, and Technology, and her team play such a critical role. We have three missions, right? We have research, we have education, we have clinical care. They help in all three. The Schaefer Library has 66 databases. They have 2,774 e-books, electronic journals, 29,657. Wow. And we've shared in the last year 4,500 journal articles with other libraries, including half within the Capital District. So again, the Schaefer Library plays a role not only in Journal Club, not only in the education of our workforce, but it provides a role in the region. And so thank you to Enid and her team. They do such a great job.
You know, it's interesting, Dennis, something we all take for granted. I go in and use that resource all the time, but boy, I never realized the depth and breadth.
And it's all available right on your computer as well.
That's great.
So finally today, my tie is Hockey Against Cancer. It's purple, of course. And Patty Mayo, one of the nurse managers in the ED, PTD gave it to me.
It.
So thank you
Very
for this
stylish.
tie. Yes, very good. That'll do it. We'll be back on Tuesday. And we'll have some information then. We're waiting to hear from some services who want us to highlight the great work they do, so don't hesitate to reach out to us.
Give us a call.
Give us a call. All right, good. We hope you have a good weekend. It's going to be warm, perhaps hot, so please stay cool. We'll be back next week. We ask that you once again please take care of yourself, take care of each other, and we'll see you Tuesday.